Hi, my name is Dr. Samuel Pegram. I'm a rheumatologist and I would like to welcome you to the living room. Not that type of room, but RHEUM, as in rheumatology, a place where we discuss autoimmune and rheumatologic issues in a comfortable environment, always from the patient's perspective. Today we're going to talk about one of the most common, if not the most frequent, autoimmune disease that a rheumatologist sees in his office on any given day. Now, the name of that disease is rheumatoid arthritis. Now, I see that look on your face because a lot of people forget that rheumatoid arthritis is a system-wide autoimmune condition. In fact, patients with rheumatoid arthritis may have their initial presentation at the ophthalmologist's office because of redness, pain, change in visual acuity due to inflammatory aspects of rheumatoid arthritis. Or they may have their initial presentation at the pulmonologist's office because of shortness of breath, decreased exercise tolerance, and unrelenting cough due to something called rheumatoid lung. All part of the system-wide symptoms that are associated with the autoimmune disease, rheumatoid arthritis. In fact, a number of patients are surprised that the target organ of the immune or autoimmune process is not bone and it is not cartilage. It is something called the synovium. The synovium is that lining inside the joint capsule that surrounds the ends of the bones that makes up the joint. As autoimmune cells target that lining, the synovium, there's proliferation of the cellular elements within that capsule. More cells grow and reproduce and replicate. And as they do, they release into that environment a number of chemicals, enzymes, substances we call cytokines that progress and propagate the inflammatory process and destroy the underlying tissue, including bone, cartilage, ligament, tendons, blood vessels, etc. So a much different disease than we think of as just an arthritis like we do in osteoarthritis, which is primarily a disease of the cartilage. It also presents different. Rheumatoid arthritis is a disease primarily of younger individuals. Most people develop their symptoms of rheumatoid arthritis, adult rheumatoid arthritis, between their early 20s and mid 40s, although it can occur at any age. There is, of course, juvenile rheumatoid or inflammatory arthritis. So children can also get the systemic autoimmune process of rheumatoid arthritis. It also, because it is a systemic disease, has systemic symptoms such as malaise, fatigue, unexplained weight loss, sometimes changes in cognitive function, all associated with a disease called rheumatoid arthritis. Whereas arthritis is probably the most common presenting symptom, but as you see, a much more widespread illness that does require a lot more thought and more aggressive medical management. We also look to where the arthritis occurs to help us differentiate rheumatoid arthritis from a more common form of rheumatism called osteoarthritis. Rheumatoid arthritis not only affects younger people, but it also is a disease of smaller joints, generally the joints of the wrist, and also the more proximal bones of the hands called the MCP joints, and those joints in the middle of the finger called the PIP joints. The distal joints, DIP joints closest to the fingernail, are less likely to be involved, although they can be. But we see those particular joints more involved in osteoarthritis. We also see larger joints such as the hips, the knees, the back more commonly involved in degenerative joint disease or osteoarthritis. Rheumatoid arthritis tends to be symmetric. It goes on in one hand, goes on in the other. Stiffness is a major part of rheumatoid arthritis. Mornings are generally pretty horrible. It takes patients 30 minutes to 90 minutes to get started with their day because of the severity of the stiffness associated with rheumatoid arthritis. These patients often feel ill because their immune system is hyperactive, it's reactive, it's ongoing, it's active. These patients often feel tired. They have low-grade fevers. They feel ill because it is, again, a system-wide disease. And unfortunately, mortality rates in patients with rheumatoid arthritis are unfortunately greater than that of the general population in patients with osteoarthritis. But fortunately, we now have at our disposal a wide variety of wonderful, powerful medicines that now allow us to attend to the devastating progression and crippling of rheumatoid arthritis that we before did not have at our disposal. So it's a great time for the treatment of rheumatoid arthritis. And the earlier we initiate that treatment in patients with rheumatoid arthritis, the better their prognosis and outcome. Now we even dare to mention the word remission, because now we have that opportunity with the early use of these very good and powerful medications. And that is exactly what we're going to talk about at our next visit here in the living room. We hope to see you real soon. Bye-bye.